My name is Ted Poe, and I'm here with my friend Kevin Brady and members of Congress to talk about the new health care bill that was worked on in the dark caverns of the Capitol for 3 weeks and filed Friday, and we expect to vote this Friday on this bill. It is 1,990 pages long. It will cost $1 trillion. It has the word shall in it 3,454 times, as compared to the 10 Commandments that was written on 2 tablets of stone. The word shall was mentioned only 10 times, and 2 religions have their basis for that document. But yet we have this massive bill that will control 1/6 of the nation's GDP. It will raise taxes. It will cost $1 trillion, and it will take over health care in this country. The reason we are at this location with these doctors is because they have already invested several $1,000,000 to build a doctors-owned hospital. But this new bill, since the government will regulate hospitals and doctors-owned hospitals, will prohibit them from building this structure because the government is taking over health care. Taxes will increase. Taxes will increase on businesses, especially anyone who does not have health insurance will be required to buy health insurance. If businesses don't furnish health insurance for their employees, they'll be taxed 8.5%. If an employee, or rather a citizen, doesn't have insurance, if they don't buy it, it will cost them 2.5% of taxes. But in essence, these are not taxes, these are fines imposed by the federal government. And nowhere in the U.S. Constitution does the federal government have the authority to force Americans or businesses to buy anything. And yet, so this must be, or there are some constitutional issues regarding this fine that is imposed upon individuals and businesses. What if they don't pay this fine? Do they go to jail without benefit of a lawyer, without the benefit of a trial by jury? These are some questions that have yet to be answered because of this complete government takeover of health care. They will ration health care, they will determine what procedures these doctors will be allowed to perform, and they will set the fee. The federal government, bureaucrats, 23-year-olds will set the fees for these doctors and the hospitals. Those are some of the concerns that many of us have about this health care bill, and our solution is to take one issue at a time and solve that problem rather than having the government completely take over health care as we know it in this country. Right now, I'm going to turn the comments over to my friend Kevin Brady, who is another member of the congressional delegation from Texas.
Well, thank you, Congressman Poe. We're here in Ted's district to talk about the economic damage and the healthcare damage that will result in this bill. Hidden inside this 2,000-page massive bill is one provision, Section 1156, that effectively closes down physician-owned hospitals that were under construction or didn't have their final Medicare paperwork as of last January 1st. By changing the rules in the middle of the game, the impact of Washington's new rules will be that we will close down 40 hospitals in Texas, costing us nearly 15,000 healthcare jobs and all the tax revenue at the state and local level that goes with it. In the Houston region, we have a number of hospitals, some under construction as the one is here today, others that are up and operating already but simply didn't have their final Medicare paperwork as of January 1st. Again, thousands of jobs, literally in Texas, over $500 million of construction that will be lost just because Washington is picking winners and losers. And that's the point here today. We need all sorts of models of health care. Some are physician-owned, some are academic models, some are for-profit, and some are non-profit models of care. By Washington picking winners and losers among these models, it's actually the patients who suffer. This provision will harm access to care in our region. It will stop expansion of care, not just in Houston, but in the Valley and rural Texas. It'll cost us tens of thousands of jobs and millions of dollars of construction. It's wrong.
Right now I'm going to let Dr. Basaldua, who is one of the doctors who have invested into this project talk about the impact this project and the federal government's intervention will have on him and patients in this area.
Thank you. I'm Dr. Martin Basaldua. I'm a family physician. When I became a doctor, I took an oath that I would first do no harm. This bill does a lot of harm to the American people, and it takes it off the back of our most vulnerable citizens, the senior citizens. $500 billion will pay for this health bill in a program, Medicare, that is already scheduled to go broke in the next 10 years. Whatever we do, there are solutions to these problems. As the congressmen have said, we take a problem at a time and solve that problem, but don't replace the best healthcare system the world has ever seen.
My name is David Carpenter, and I've been a family doctor here in Humble, Texas for the last 30 years. I've seen this community go from a small town atmosphere to a part of Houston, Texas. With that, we've had tremendous growth in this area. We have 2 hospitals that are here now. I've tried to get a patient in today, and both of these hospitals are full. They're at capacity. This is not happening just on a regional basis or a local basis. It's happening all across the United States. The need for health care will continue to grow, and as our population continues to age, we need increased access, not restricted access to health care. So my plea is that the American population and public look at this as an opportunity to expand health care and have doctors involved in your health care, not put on the curb, not put to the side. We're here to help you. Thank you.
Might add, the hospitals that are already in existence, whether they be doctor-owned hospitals or whether they be privately owned or charity hospitals, will still not be allowed to expand without the federal government issuing the okay to do so. And the federal government has no business trying to tell a hospital, any hospital, whether it should expand or not. And this is just one example of health care being controlled by the federal government, getting involved in the lives of not only patients, but doctors and the economy, to the detriment of our economy. Besides the tax increase, the massive cost to set this bill up, and taxes, it's interesting, the taxes start now for 3 years if the bill passes, but yet the bill doesn't take effect until 2013. One of the few examples of where even the federal government doesn't have the project ready to go up and go until after 3 years of taxation upon the American public. Kevin, is there anything else you wanted to mention?
No, I would just point out this provision has real consequences. St. Luke's just opened a cardiovascular and orthopedic center, 30 beds connected up in the Woodlands, almost 200 jobs that would be stopped under this bill. Reliant Rehab Hospital has several projects as well. One of them that's up and running, 150 workers, $15 million of investment, but they got their Medicare paperwork 23 days too late, according to this bill. We'll lose those jobs and that care, and it's all around the Houston region. We're going to see projects, valuable projects, critical to patient care, stopped in their tracks, and even those that exist today will be stopped from expanding to serve their community. So if this health bill is supposed to increase access, it's actually restricting access in some of the communities that most need that care.
The last thing I would mention is that this hospital is in a perfect location because of the growth out here in my congressional district. Right across the road here is Intercontinental Airport. And as Dr. Carpenter had pointed out, the hospitals over in Humble and over in the northwest part of town are full. And these doctors want to find places to treat their patients, but yet the federal government, from some odd reason, wants to prohibit access to the patients of the Humble, Kingwood, Woodlands area to new development and new hospitals, besides the fact the investment that has been imposed by these private individuals, and the federal government is just saying they cannot open. So any questions?